Our goal is to be the best rural hospital, and I think we can do it. If we truly want to address the cost of healthcare across this country, we have to address the patient holistically. That means you have to not just look at the disease state why they were admitted, but look at the other things that affect that. Is it nutrition? Is it related to their home environment? Is it socioeconomic? Do they have access to social services when they go home? That's our role as a healthcare provider, is to really be able to step in and make sure we help manage that patient towards the most successful continuum they can get to.
Routine medical care is better for the patient, number one, because we can keep those issues from becoming emergencies. If patients take their blood pressure medicine, their diabetes medicine, their COPD medicine on a daily basis, it prevents the exacerbations and the hypertensive crisis that brings patients to the emergency room.
That was really part of our project scope, was really around how do we move non-emergent patients out of our emergency department.
Trisha's in the emergency room every day. She interacts with those patients in real time, able to communicate, about the primary care clinic.
An emergency room visit can be stressful or overwhelming for some patients. So, having a patient navigator visit with the patients, go over their discharge instructions with them, and help them schedule a follow-up appointment with either a primary care provider or a specialist gives the patient one less thing to worry about when they get home. It also helps promote continuum of care, so patients don't keep coming back to the emergency room over and over again for the same issue or for their non-emergent needs. It is reassuring for patients to know that their contact with the hospital does not end after their emergency room visit, because they will get a call from the patient navigator to check on them, address any questions or concerns that they might have, and help them schedule their follow-up appointment if needed.
When I was discharged, I was to have a follow-up at the walk-in clinic and then have a follow-up with a primary health care doctor. I didn't get a chance to go to the primary care provider at that moment because of work.
I asked Ryan if he would like me to call the primary care clinic so he can make an appointment, and he said yes. So we looked over his work schedule to see what day he would be free, and then I called the primary care clinic, and Ryan was able to schedule a primary care appointment. Ryan went to that appointment, and he has been a primary care patient since then.
Well, when Trisha's asking me how I'm doing, it makes me feel very, very confident and very relieved and warm inside, that I know that somebody's actually worried about how I'm feeling.
We believe that's a driver here that we can do for this community, and that is to truly provide, to be proactive, and so provide primary care so that we don't have patients present in the ER with these catastrophic illnesses.
The Delta program has been very helpful in many ways, from guiding us with identifying our target population, to planning and implementing community action planning events, to providing the resources and training that I needed to function effectively in my role as a patient navigator and community champion.
Then it's allowed us to be able to address the health and wellness of our community. We took our community health needs assessment and kind of overlaid that over our strategy with our navigator. We understood what the 5 biggest determinants of health were in our community, and that's how we began to address them.
So the entire picture of healthcare goes beyond what happens at the clinic with us. They need to maintain the healthy diet, the lifestyle, exercise, eating healthy. NRMC provides health fairs and community outreach programs to kind of help expand past just the medical part of whole wellness. We do have a partnership with the food pantry, and we do promote that. We go out there and work those days and help hand out, the groceries and the food for the community. And that's a big statement for this community, because they see us out there helping and working with them to promote a healthy lifestyle.
we're on a journey of zero patient harm. And we believe if we take care of the patient the right way, everything else falls into place. Everything we do is driven on outcomes, 100%. We don't make a decision on anything if we don't have a metrics to measure it. And that's one of the disciplines and the rigors we've pulled from our work over the last 3 years. If you had to pay for everything that DRCHSD did for us, I don't know if we could have afforded it. I look at that as a huge gift for our organization and really for this community, more so than anything else.